My husband came and sat with me in the afternoon after my mum and my mother-in-law had been with me during the day to calm me down because I was starting to panic by then. And they took her that night very, very quickly.
Preeclampsia is a condition specific to pregnancy, and it affects women in their second half of the pregnancy, and what we see is that their blood pressure rises, sometimes to dangerous levels, but most often the labours are induced and often early.
High blood pressure in pregnancy is the commonest cause of a medical problem in pregnancy, and that occurs in about 10% of women. Preeclampsia is a condition where another organ system is involved. So most commonly the kidneys, and women will get protein in their urine. The liver gets involved, so they can develop liver failure. And one of the serious complications of it is women can actually have convulsions.
We weren't sure whether she'd be breathing, we weren't sure what kind of long-term effects it would have on her. We weren't, like, just the unknown was really, really scary for us. That was probably the worst bit. But also knowing that I can't take her home. That sucks. Sorry.
We've recently looked at the data from the first 165 women who participated in the trial. 35 of those had preeclampsia in their pregnancy, the others had normal blood pressure, and what we've seen so far is a striking difference between their blood pressures at 6 months after they give birth.
She asked us to be part of it so that they could monitor Lily's progress and my progress, and I really never want anyone to go through what I did.
Women who've had preeclampsia are concerned that their babies long term are going to have problems, and we're identifying that the risk of that is very small.
I think medical research is crucial to the future health of our population. It's the only way we make improvements in our healthcare, in treatments, in learning about problems with our health. The PFOS study would not be able to proceed without funding. It's quite expensive for us to have the children seen by a paediatrician and the developmental psychologist, as well as the everyday running of it. Research can't function without support from different funding sources, so please support the St George and Sutherland Medical Research Foundation.